Hello friends, today I will discuss about efficacy guidelines and modules. First of all, to the ICH means International Conference of Harmonization. It is an technical requirements for to registration of pharmaceutical for human use, and it is to be a representative of United States, USA and Japan, and it is US and it is to be during for a safety guideline, efficacy and quality guideline. First, it is an include to a efficacy guideline. It is to be a E1 and E20 guidelines. It is an clinical safety in human beings. Clinical safety. It includes clinical safety, clinical trial, clinical investigation, clinical studies, and clinical evaluation, clinical safety, etc. These are the guidelines of E1 to E20, except it E30. First is E1 guidelines. It is an clinical safety for drugs used in a long-term treatment. It includes in the number of patents and duration of a exposure. So do a safety evaluation. It is an E1. Next is E2. E2 is a clinical safety data management. It is including data elements for transmission, including uh, um, terminology. Next is E2B, means clinical safety data management. It includes data elements for transmission of individual case safety reports, means ICSR. Next is E2C. It is to be a periodic safety drug evaluations and risk evaluation. It is to be a this document gives the guidance and contents of a safety requirements. Fifth guideline is a E5 is a post-approval safety data management. It includes this document for approval for safety drug management. E E2F means pharmacovigilance planning. It is include to the post-marketing surveillance of any new drug. Next guideline is E2AF, means development for a safety update report. It is only include to the biologicals. E3 guideline, it means structure and content of clinical study reports. Next guideline is E4. It includes the dose information to support drug registrations. Next is E5 guideline. It includes ethics factors. It is an acceptability of foreigner clinical trials. Next is E6, means good clinical practice, GLP. Next is E7 guidelines. It includes studies and supports of special populations. Next guideline is E8. E8 means general consideration of clinical trial. E9 means a statistical principle for a clinical trial. Next is E10. E10 means guidelines for a choice for control group and related for to a clinical group. Next is E11 guideline. It is an clinical investigational and to a medicinal product. E E12 guideline. This guideline is included to the principles for clinical evaluation of antihypertensive drugs. Next is E15 guidelines. This include to definition for genomics, genoethics, biomarkers, pharmacogenetics, and pharmacogenomics and genomics data. It include to the E50 guideline. Next is pharmacovigilance guidelines divided into two parts. First part is modules on a pharmacovigilance process. Second part on the basis of the production of a popular basis. First guideline, it includes module 1 to 10 modules, and next is 11 to 15. It include to the biopharmacovigilance to discussion phase. First module it include a pharmacovigilance system and a quality system. Second module is a PV system and master file. Third module, PV inspection means pharmacovigilance inspection. Fourth is PV audits. Fifth is risk management system. Sixth module is to be a management and reporting adverse drug reaction. Seventh module is a periodic safety update report PSUR. Eight modules post authorization safety update report. Ninth module is a signal management. 10th report is additional monitoring. Next module 11 to 15 are to be a discussion phase. It also include to a safety communications 15, and 16 modules is to be a risk minimizations of the effectiveness indicators. These are to be include modules. Thank you.